Hi, my name is Dr. Emily Splichal, and I want to talk to you about peripheral neuropathy, a condition that affects millions of people but often isn't well understood. If you are experiencing numbness, tingling, or burning sensations in your feet, or if your feet feel unusually sensitive to the touch, you may be dealing with peripheral neuropathy. Peripheral neuropathy happens when the nerves of your feet become damaged, often due to diabetes, but it could also be the result of other conditions and treatments. Think of the nerves like electrical wires that carry messages between your feet and your brain. When these wires get damaged, the signals get mixed up. Some of my patients describe it as walking on pins and needles, while others say their feet feel like they're burning or completely numb. The frustrating thing is that even though your feet feel like they might be numb, they're also incredibly sensitive to pressure and to touch. It seems completely contradictory, but that's exactly how nerve damage affects sensation. Here's what's really concerning about peripheral neuropathy. When you can't feel your feet properly, you are at risk for injuries that you might not even notice. A small cut, blister, or pressure can become a serious problem because you simply don't feel it happening. That's why the shoes you choose become so important when you have peripheral neuropathy. Your feet need extra protection since they can't protect themselves the way they used to. When I work with neuropathy patients, I emphasize shoes that act like a protective barrier for these sensitive feet. The interior needs to be incredibly soft and seamless. Any seam or rough spot can create pressure points that damaged nerves might not detect until there's already a problem. I also look for shoes that don't bind anywhere across the foot. The upper material should be flexible and non-restrictive because neuropathic feet can be unpredictably sensitive to pressure. Good arch support is essential as well because it helps distribute your weight evenly and prevents any one area of the foot from bearing too much pressure. The shoes I recommend have soft, padded interiors that eliminate any potential friction points. They also provide stable cushion support that helps protect feet that can no longer rely on the normal sensations to avoid injury. As someone who partners with Orthofeet, I've seen how their design specifically addresses these protective needs that neuropathy patients need. Living with neuropathy means being extra thoughtful about protecting your feet, and that starts with the right shoes. Orthofeet shoes are designed with the kind of protective features I recommend for my neuropathy patients. Soft interiors, proper support, and gentle, non-binding fit. Your feet deserve that extra protection and care. Don't let neuropathy limit what you can safely enjoy.